So hello and welcome everyone. My name is Pamela Abner and I'm the Vice President and Chief Diversity Operations Officer at Mount Sinai Health System in New York. And welcome to Aspen Ideas Festival. It's a pleasure to be here with you today. And we're going to have a great conversation and chat with Dr. Christina Gonzalez from Albert Einstein College of Medicine and Montefiore Health System in New York as well.
That's us. Hi.
So, hi. And just going forward, Christina, I'm going to refer to you as Christina, if
Pamela,
that's okay?
that sounds fantastic.
Okay, so we'll just have a nice, comfortable conversation.
I like it.
So, I know that you've been doing a lot of work in the space of implicit bias and really the impact of that on our patient care, but also in terms of our faculty, staff, students, and others. So let's just talk a little bit and talk to us about what you've done and what's different in terms of your focus on implicit bias.
Sure. So we actually, our team coined the term implicit bias recognition and management. Hashtag IBRM. Make it trend. And so because it's so important as we get out there. So implicit bias recognition and management, meaning we have implicit bias. It's human nature. We may have little variations, but we have it, right? And in and of itself, that does not make you a good or bad person. It just makes you a human. But when it affects our behavior in a negative way, then we need to recognize that that is happening. Right? And then through our curricula and others, we have skills that you can develop to then be able to manage the situation, checking with your patient, checking with your colleague, realize you made a mistake and proactively and reactively address it, so that you can manage the situation, have the optimal outcome that you were seeking consciously in the first place. Right? We all want to do the right thing.
Yep. So what do you do to make that actionable? Like what's different? So, we've done a lot of work at Mount Sinai Health System, several years now deep into really focusing on bias and implicit bias and thinking about outcomes and thinking about how we speak to one another and focusing on our own self and our perceptions and associations. So what's different and what are you doing with your medical students that might be different from what other approaches that others are taking?
So I know you're doing great work at Mount Sinai, and so if I say something is different and you're doing it, it's just that I don't know comprehensively all the details. Sure. But it's great work that y'all are doing at Sinai. And so what I would say is that we focus a lot on the opportunity for skill development and practice. A lot of the literature has stopped at awareness, right? And we don't actually want to hurt anybody, right? So when we're aware, then we're just, oh no. And then without a skill, then we actually, there are data for avoidant behaviors. Right? And so for us, we do role plays, we do active learning, we practice what are called verbal procedures where, I might say, oh sure, I'd apologize. That's not a verbal procedure. I need to articulate verbatim what I would do. You'd be surprised how it's hard, right? And then, but once you practice it, you would never put a needle in the human without practicing first, or any manual procedure. Absolutely. So why do we expect verbal procedures to come second nature? And so we practice.
So you're practicing with whom? Students, faculty, who's involved?
So our students are involved. We do role plays. We also have standardized patients, right? The actors that help then give feedback. We have faculty that are involved in trainings as well. Again, active learning. They do a lot of our trainings for our students, so they kind of learn by becoming a mini train-the-trainer. And our current work is working on simulations with physician volunteers, trying to get the standardized patients, the actors. It's a simulation that's beyond the scope of right now, but a patient encounter, and we're looking at the outcome metrics so that we can get evidence for how to measure them, so then we can transfer it to the clinical setting.
And what are those metrics? Are you able to?
We're discovering them.
You're discovering them.
Some of them, we're building on some that have been published in the literature. Interpersonal distance got ruined by COVID because we can't actually be in the same room. But interruptions, eye contact, which you can do on Zoom, is the inverse of eye contact. There's the open-ended questions, there's empathy statements where some of them are just basic communication skills, but they tend to go awry, we're seeing in our preliminary data, when there's the time pressures involved. And we put time pressures and what are called cognitive stressors. If I can expand on that for one quick second. Sure. Bias doesn't happen all day, every day. Right? It comes out when we're stressed, when we're pressed for time, when we're fatigued, when there's uncertainty, clinical uncertainty, and maybe I don't know you very well.
Right. Those automatic responses that we go through.
Also known as every day at work. So that's why we build these skills.
Okay, great. Okay, so just, as we want to wrap this up, just tell me what you think the future would be in terms of, you've been doing this work, you're focusing in this direction. What will it feel like in 5 years? What would be different in the healthcare system or environment?
So from what I hear from some of my mentors, people didn't always wash their hands between patients.
Yeah.
Right? And so by the time I trained, there was a sanitizer outside of every room, et cetera. And I want that to be for implicit bias in the sense that it's just another skill we have, another thing we do, another part of excellent patient care. The judgment is removed and we all grow in skills together.
Yeah, I think that's so important, especially when we talk about removing that judgment, right? That kind of gets people away from being defensive. So Christina, thank you so much for this conversation. It was great, and I know we could spend a lot more time on this topic. And for our audience, I hope that you found this useful and engaging as we did. And we look forward to bringing this information forward again in the future around bias and how it's so important for the work that we all do. So again, thank you so much for joining us.